Hi, dear friends. I'm Dr.Rajasekhar Mysore. Main factors affecting the recurrence of fistulas. Fistulas are nothing but anal gland infections which are present in the anal canal about 1 to 2 centimeters deeper between the two layers of muscles which will control the continence mechanism. So when they get infected, pus will form, they'll form holes outside and start coming out. The pus starts coming out. That we call them as a fistula. So in that, what is the problem in treatment of fistula? Fistulas are always treated surgically. There is no medical treatment to cure fistulas. So when we do surgeries for fistulas, there are two issues. One is if we do very extensively and damage those sphincters during our surgery, then patients may lose the control over their bowel movements. The other issue is if we don't do properly, then there will be recurrence. So to balance that, we have got different methods of approach, different gadgets and different technologies used for balancing that. Neither there should be any damage to the sphincters and the recurrence rate should go down drastically. So with this, what are the factors for recurrence? So we in our center, which is a tertiary care center, almost 30 to 40% of the fistulas are recurrent fistulas where already they have undergone surgery once or twice somewhere else and they are coming back. So when we analyze the causes for it, there are three different causes. One is incomplete surgery. Incomplete surgery means if somebody has got an abscess, collection of pus, if only that pus is drained, the source is somewhere deeper. If it is not cleared, it is almost always possible that it will recur. So that is incomplete surgery is one cause. Second cause is inherently there are some fistulas with multiple extensions. So there is a possibility of missing one or two tracts which can again cause recurrence, or the anal gland getting again infected in some other area and getting recurrence. They are called denovo fistulas. Third is there is something called specific fistulas. A fistula is caused by some specific diseases like Crohn's disease, tuberculosis, that sort of things, which will not heal unless we treat the disease itself. We have to give medical treatment for tuberculosis or Crohn's disease, then only they cure. Otherwise, again they recur or they may not heal at all. So these are the factors. One is incomplete surgery, inadequate surgery or improper surgery. Fistula is somewhere, operation is done somewhere else. It's all very possible because it's a very delicate area and very small area where all the important organs are all packed together. Sphincters, blood vessels, nerves, all those things are very, very packed in a very small area. So very delicate surgery is to be done. It's not simply you put some laser and it will go and treat. There is a lot of misconceptions about it. So lasers and all are wonderful gadgets when it is used properly, or it can cause a lot of damage if you don't know how to use it. A little increase in the generation of the energy or improper usage of the fiber or the direction of the fiber, all that can cause a lot of damage. And so it should be used very carefully to get the best results out of it. So one is, there is no proof that if you use lasers it won't recur. It is completely false. Laser treatment does not say that there won't be any recurrence. Recurrence has nothing to do with usage of lasers. Lasers will help us in minimizing the wound. That's it. So now I want to give some tips to prevent a recurrence of fistulas after surgery. One is, whenever you are going for surgery for fistula, the first surgery is the best time to prevent recurrence. Once it is done somewhere and not done properly, and when it recurs, the second surgery becomes more difficult, more complex, and third and fourth will be much more difficult. The first surgery is the best time to clear the complete fistula tract and get the almost zero recurrence if it is a simple fistula. But unfortunately, if there are other factors, factor it out and say that insurance, financial issues, very far off place, so many other factors they will take into account, and they get it done somewhere where it may not be very proper place to get the surgery done, and then they come with recurrence. So first, this one is to prevent recurrence, is get it done in a proper center where the surgeon is well versed and all the technology and other things are available. Complete diagnosis is made before starting the procedure. Well-planned surgery is to be done. These are all very, very important to prevent a recurrence of fistulas. The first is preoperative, that you have to choose the correct place and correct surgery is to be done. Second is after surgery, the follow-up is very, very important. So whenever we do surgery for fistula, I tell my patients, now 50% of this procedure is over. Now next 50% is post-operative care. So they must be coming regularly. We have some protocols accordingly to get checked regularly till the wounds completely heal. So there is a protocol for that. That is very, very important. Third thing is, we would have given some advices for some people. If I put a sit on, we have put some tubes and all that for washing and all. Different instructions will be given to them. They have to follow it very meticulously for a few days. And they can start attending to their work within 3-4 days to their routine work. But coming and showing is very, very important. Then, if antibiotics are required for a particular period of time, they have to use. If the infection is persisting, we may do cultures and say we may be changing the antibiotics. Or we may search if there are any hidden pockets of infection, we will be clearing it. These are all part of prevention of recurrence. Third is people using too much of two-wheeler driving or cycling, that sort of thing. In immediate post-operative period, it is to be avoided to prevent damage and bleeding, pain and all those things. Fourth is if there is a medical disease associated with this, like diabetes, HIV, hepatitis B, certain things which are there on steroids, so immunosuppressants. So where the body's resistance is low, the chance of recurrence goes up. So they have to keep all of them under proper control, and then fistula treatment is to be followed. If the sugar levels varying very much, then it can cause delay in healing or even recurrence. So these are all some of the tips. And avoid constipation. And in long term, we have seen patients who are completely cured after 10 years, 20 years, getting back again. So for them, if you develop a mild infection there, then we have to start antibiotic as early as possible and go and show to the surgeon as early as possible. Don't wait for 1 week, 10 days till it becomes pus formation and then ends up with again one more surgery. If it is a very mild infection in the beginning, with antibiotics and all, we can avoid formation of fistula. So these are some of the tips one has to follow.